Imagine looking into the toilet and noticing something you definitely weren't expecting to find there, or waking up several nights in a row with a strange itch, or noticing that your skin looks paler, your weight is dropping without explanation, and your bowels simply aren't working like they used to. Could your body be giving you clues about the presence of an intestinal worm? The answer is, in some situations, yes. But there's an important part of this story that almost never appears in videos about this subject. Many intestinal worm infections may cause few symptoms, or none at all. And several of the signs we'll discuss today can also occur for many other, completely different reasons. So this video is not a test to find out if you have worms. It is a scientific investigation about 7 signs that may appear in some Helminth infections, and that deserve to be properly understood. And pay attention to the number 7. Because it doesn't necessarily mean you have a parasite, but it's a sign that you shouldn't simply ignore. Before we begin, there's something interesting we need to understand. When we talk about intestinal worms, we're not talking about a single organism. Pinworms, hookworms, roundworms, whipworms, and tapeworms are different organisms, have different life cycles, and can produce different symptoms. Some may remain virtually silent. Others, especially when the number of parasites is high, can cause digestive problems, nutrient loss, anemia, and other complications. The World Health Organization emphasizes precisely this. The intensity of symptoms is related, among other factors, to the parasite load. Mild infections by soil-transmitted helminths often do not produce noticeable illness, while more intense infections can cause intestinal symptoms, weakness, and nutritional changes. And that brings us to the first clue. Sign number 1, something unusual appearing in the stool. This is probably the sign that would make practically anyone take a double look at the toilet. Imagine finding something whitish, elongated, or resembling small fragments in your stool. Could it be a worm? In certain cases, yes. In intestinal infection by tapeworms of the genus Taenia, for example, small segments of the parasite, called proglottids, can be eliminated in the feces. According to the CDC, the passage of these segments is among the most visible manifestations of Taeniasis. But there's a trap here. Not every thread, fragment, or foreign structure found in feces is a parasite. Food scraps, plant fibers, mucus, and other materials can produce appearances that can easily confuse an untrained person. Therefore, photographing or preserving a sample in a way guided by a professional can be much more useful than trying to identify it using random internet searches. Your toilet might provide a clue, but it's not a laboratory. And the second sign happens at an even stranger time, when you are sleeping. Sign number 2, intense itching around the anus, especially at night. You will sleep normally. A few hours later, a persistent itching begins to appear in the anal region. You change position, coca, go back to sleep. And the following night it happens again. The reason is almost cinematic. During the night, female worms can migrate to the area around the anus and deposit their eggs on the skin. It is precisely this activity that can cause a very characteristic itch. The CDC considers persistent perianal itching at night one of the most typical signs of pinworm infection. The tiny worms can also, in some cases, be observed near the anus a few hours after a person falls asleep or appear on clothing and bedding. But be careful. Itching in this area can also be caused by numerous other conditions. Therefore, to reiterate, a suspected pattern does not mean a confirmed diagnosis. And here's another interesting fact. For pinworms, simply performing a conventional stool test is not always the best strategy. There is a method called the tape test, used to collect eggs from the skin around the anus, usually in the morning, before showering or going to the bathroom. Now let's step outside the intestines for a few seconds, because some parasites can leave a clue right at the entrance, your skin. Sign number 3, an itchy area of skin or an unusual rash. Imagine walking barefoot in a contaminated area. You feel absolutely nothing at first, but then a reddish, itchy area appears exactly where certain larvae penetrated the skin. Some species of hookworms can enter the body through the skin. The CDC describes itching and a localized rash as possible initial manifestations of human hookworm infection transmitted through soil. Another worm, the Strongyloidiasis, it can also penetrate the skin and produce skin manifestations in some people. Still, many infections by Strongyloids, they remain asymptomatic. This is important because it reveals something fascinating about parasitology. The symptom doesn't always appear exactly where the adult worm will remain. The parasite's life cycle can involve different parts of the body. But a skin rash on its own is far from meaning that a person has worms. Dermatitis, allergies, insect bites, skin infections, and numerous other conditions are much more common in various contexts. Now, the fourth sign can appear when you simply look at yourself in the mirror, and the mechanism behind it is even more interesting. Sign number 4, paleness accompanied by weakness or fatigue. Observe the pellet, the lips, the inner part of the eyelids. A person who used to be energetic begins to notice frequent fatigue and appears paler. What would an intestinal worm have to do with this? In certain hookworm infections, quite a lot. These parasites can attach themselves to the intestinal wall and contribute to chronic blood loss. When the infection is severe enough, it can contribute to iron deficiency and anemia. The CDC links major hookworm infections to blood loss, anemia, weakness, and paleness. Think about the sequence. Intestinal blood loss over time, lower availability of iron, reduced ability to produce hemoglobin adequately, and then the body begins to show that something is not working properly. But there is a fundamental caveat here. Anemia and paleness have many causes. Nutritional deficiencies, gastrointestinal bleeding unrelated to parasites, chronic diseases, and various other conditions can produce the same result. Therefore, when someone presents with persistent paleness and fatigue, the correct question is not, which worm do I have? The correct question is, why is this happening? And the next sign usually causes even more concern. Sign number 5, weight loss without a clear explanation. You haven't started a diet. He didn't increase his exercise. He's not trying to lose weight. Even so, the balance is starting to tip. Some parasitic intestinal infections may be associated with loss of appetite, nutritional changes, or weight loss. In the case of Ascariasis, for example, the CDC describes possible symptoms such as digestive problems, abdominal discomfort, changes in appetite, and weight loss. But there's a popular myth that we need to debunk. Having an intestinal worm, it doesn't automatically mean losing weight. There are parasites that often cause few symptoms, and some worm infections are not even associated with weight loss. Therefore, the old idea that if I'm losing weight, it must be worms is simply not scientifically reliable. And most importantly, unexplained weight loss deserves investigation because it can happen for many other reasons. Don't use a seemingly simple explanation to ignore an important change in your body. Now observe another region of the body, your abdomen, because the 6th sign can be very easy to confuse with something completely trivial. Sign number 6, persistent abdominal changes along with digestive symptoms. Everyone can get bloated from time to time. A large meal, certain foods, constipation, gases. All of this can temporarily alter the abdomen. Therefore, simply looking at a swollen belly and saying those are worms would be a mistake. However, some Helminth infections, especially when more severe, can cause abdominal pain or discomfort, diarrhea, and nutritional changes. The WHO describes abdominal pain and diarrhea among the symptoms that can appear in more severe infections by soil-transmitted Helminths. Ascariasis, caused by the roundworm, can also cause abdominal discomfort or pain in some people. And there is a huge difference between a mild infection and a very high parasite load. In severe cases, large quantities of Ascaris, they can rarely become bowel blocking. This brings us to an extremely useful rule. Don't just think about the symptom, think about standard. How long has it existed? Is it getting worse? Are there other symptoms occurring at the same time? Was there any relevant exhibition? Because abdominal pain alone is extremely nonspecific. Abdominal distension alone is also a factor. Diarrhea on its own too. Context completely changes the interpretation. And now we come to number 7, but before I reveal it, there's something you need to know. If you've come this far trying to see how many of these signs you have, beware of a mental trap. Having 3, 4, or even more symptoms from this list, it doesn't prove you have worms. Symptoms don't function like points on an internet quiz. Diagnosis depends on the type of parasite suspected, the symptoms, the history of exposure, and, when indicated, appropriate tests. Now, yes, the final sign. And this deserves special attention not because it proves a parasitic infection, but because it may indicate that something more important is happening. Sign number 7, visible blood in stool or severe abdominal symptoms. Finding blood in stool should never be automatically attributed to worms. There are many possible causes of gastrointestinal bleeding. Some are relatively common, others are more serious, but certain parasitic infections can also cause intestinal bleeding. Severe whipworm infections can be associated with bloody stools and anemia, and intestinal schistosomiasis can also cause abdominal pain, diarrhea, and blood in the stool. And there are other warning signs. Very intense abdominal pain, significant sprain, persistent vomiting, marked weakness, or signs consistent with intestinal obstruction. Very intense infections caused by certain helminths, such as Ascaris, they can rarely cause intestinal obstruction, a complication that requires medical evaluation. So the number 7 shouldn't cause panic, it should prompt a rational decision. Blood in the stool, intense pain, or significant worsening of general condition are not situations where you should try to find the cause by watching 10 more videos. These are situations that warrant professional evaluation. But now comes perhaps the most surprising piece of information in this entire video. You could have an intestinal worm infection and not show any of these 7 signs. Try none. Several Helminth infections can remain asymptomatic, especially when the parasite load is low. The CDC reports that many people with pinworms do not experience symptoms. The same is true for a large proportion of people infected with pinworms. Strongyloidiasis can also remain asymptomatic. And this leaves us with a seemingly contradictory conclusion. The absence of symptoms does not completely rule out an infection, but having symptoms doesn't necessarily confirm that one exists. So how do you actually find out? With proper investigation. Depending on the suspected parasite, a professional may consider the patient's medical history, exposures, travel, environmental conditions, and laboratory tests. For some intestinal parasites, testing for eggs or parasites in stool may be necessary. The CDC recommends that when this type of test is indicated, multiple samples collected on different days can increase the detection rate. For pinworms, as we have seen, there's the adhesive tape test for strongyloids. The diagnostic strategy may involve specific methods on stool samples and, in certain contexts, serological tests, i.e., there is simply no universal worm test that works the same way for all situations. And that's perhaps the main message you should take away from this video. Your body may provide clues, something unusual in the stool, characteristic nighttime itching, skin changes in certain contexts, paleness and weakness, unexplained weight loss, persistent digestive problems, or warning signs, such as blood in the stool and severe abdominal symptoms. But a clue is not a diagnosis. Science begins precisely when we stop guessing and start investigating. So, the next time someone says there's a single symptom that can definitively reveal that a person is full of worms, remember, the human body is far more complex than that, and the parasites themselves as well. Perhaps the most interesting question now is another one. If some of these worms manage to enter the body and remain there for some time without attracting attention, how do they reach us? Alone? Water? Food? Undercooked meat? Contact with contaminated surfaces? Or are they seemingly harmless habits from our daily lives? That will be an investigation for the next video. Because the better you understand how your body works, the less you need to rely on myths to interpret the signals it sends. And if you enjoy discovering the hidden science behind the things that happen inside your own body, follow the channel. There are still many signs on the body that seem strange at first glance, until science explains what's really going on. A big hug, and see you in the next chapter and more discoveries. Bye.